Hello, what's up everybody? This is Mr. Cash, and today we will talk about small volume nebulizer. Small volume nebulizer, it is the most commonly used device to deliver medical aerosol treatment. This device how does it work? It works by using a compressed gas source, and it has a liquid reservoir. That's where you will put the medication in, and it has a baffle. That's what helps break down the medication into small particles. Three ways to use this device is by using a mouthpiece, an aerosol mask, or a blow-by. A mouthpiece is what comes in the package. You will have the mouthpiece, and you will also have the tubing, the oxygen tubing, and you will have the reservoir chamber. You can either connect it to gas source of air, or you can connect it to oxygen. With COPD patients, I would recommend to use air because of their hypoxic drive, unless it's required. If the patient is unable to hold the mouthpiece, you could use the aerosol mask. And how to recognize an aerosol mask is you will see two holes on the side of it that does not have a one-way valve. However, if you are unable to use, which most likely with pediatric patients, with infants, or with a 2-year-old that would not allow you to keep a mask on his or her face, you can use a process what's called a blow-by. It's not recommended because they will not get as much as medication as you intend to give, but this is a way of helping to get at least some of the medication, which you will occlude on the end of the mouthpiece where the patient would normally place their mouth. Occlude it with your hand or with a piece of clean, sterile surface, and point it and aim it at the bottom of their nose while they're breathing, and hold it up for about 10 to 15 minutes. Small volume nebulizers normally can hold 6 to 15 ml of solution, either of medication or saline or whatever you will use. The flow of air, what Egan's fundamental of respiratory care recommends, is 6 to 8 liters per minute, but I personally used it and I will use 10 liters per minute. It depends, the higher, but nothing lower than 6, nothing higher than 10. If it goes higher than 10, it will pop off from the small volume nebulizer or from the wall from the flow meter. So aim to go a flow of between 6 and 10. And if it's lower than 6, it will not be efficient for the flow to nebulize the medication.
And one more thing to keep in mind when using a small volume nebulizer is if you have a patient on a BiPAP and you want to give them the nebulizer treatment, when you connect the small volume nebulizer to the BiPAP circuit, by adding the flow to the nebulizer, it will increase the total volume that is going to the patient.
And of course, before you give your treatment and after you give your treatment, make sure to listen to patient's breath sounds. And to do that, you will need a stethoscope. I have used many stethoscopes for the past 5 years, and I came across one of the best ones that, in my opinion, I've been using for the past 3 years. And it's not too expensive and it's not too cheap either. The cost is probably $30 to $40, depends on the color. I will leave the link to purchase it on Amazon down below, and thank you for listening.